8 signs of cervical cancer. Cervical cancer is one of the most lethal types of cancer, but when diagnosed early, it has a high chance of successful treatment. In most cases, this cancer is caused by the human papillomavirus, HPV, a highly contagious infection that is transmitted sexually. There are more than 100 types of HPV, and some can lead to the development of cervical cancer. A strong immune system can eliminate the virus naturally, but if it doesn't, it can cause the growth of abnormal malignant cells. 8 signs women need to know about cervical cancer. Even without symptoms as obvious as those of breast cancer, this type of cancer can be identified early if certain signs are recognized. If you notice any of these symptoms, see a gynecologist immediately. Unusual discharge. The presence of abnormal discharge can be one of the first signs. As cancer develops in the cervix, the cells lining the uterus begin to produce a watery discharge. The appearance of warts. Small warts, internal or external, can be a warning sign of diseases such as HPV, which is directly linked to an increased risk of cervical cancer. Pelvic pain or bleeding. Discomfort in the pelvic region and episodes of unusual bleeding can indicate the presence of cancer, as the walls of the cervix become drier and can crack due to abnormal cell growth. Rectal or urinary bleeding. These symptoms usually appear in more advanced stages of the disease. If bleeding occurs outside the menstrual period, it is essential to see a doctor. Anemia. Cervical cancer can lead to excessive bleeding, causing anemia. If your diet remains the same, but you feel constantly tired and notice an increase in your heart rate with little effort, consult a specialist. Urinary problems. Difficulty urinating can indicate swelling of the cervix, which compresses the bladder and kidneys, making it difficult for urine to flow. This can result in painful urination or recurrent urinary infections, persistent pain in the legs, hips, or back. Swelling of the cervix can affect not only the bladder and kidneys, but also internal organs. The pressure on the blood vessels can reduce blood flow to the pelvic region and legs, causing pain and swelling in the lower limbs. Weight loss. Reduced appetite and weight loss for no apparent reason can be signs of various types of cancer. In the case of cervical cancer, swelling can put pressure on the stomach, reducing hunger and leading to weight loss. Caution. These symptoms may be related to other health conditions. However, if you notice any of them, consult a gynecologist as soon as possible. If you like this article, please like it and share it with your friends.